Hi students, let's just kind of do a quick review for your exam tomorrow. Signs and symptoms, we have infectious, we have skin. So the different chapters, I'm just going to talk briefly about. Remember with your signs and symptoms, with that, keep in mind if it's outpatient, inpatient. That's a big thing. With inpatient, remember you can code that word possible. So if it says possible appendicitis with abdominal pain, okay, that means as an inpatient, they did some testing and they're pretty sure that it is appendicitis, okay? So at that point, you are going to code the appendicitis because it's inpatient. You are not going to code the abdominal pain because it's a sign or symptom of the appendicitis. Now, for outpatient, and it says possible appendicitis, we are going to code the abdominal pain and not the appendicitis because in an outpatient setting, they haven't done enough testing to come up with an actual diagnosis of appendicitis, but they're not ruling out appendicitis yet either. But you still just want to go with the abdominal pain. That kind of wraps up just, briefly on that. Let's kind of skip to chapter 2, your infectious. The biggest thing I want to cover here, and I'm not going to go through each problem, you have the answers. Make sure you review them for the test before tomorrow. If you have any questions, reach out before you do take that test. But the biggest is when to sequence B20 first for AIDS, HIV. Okay, so as you know, if the patient comes in with something related to the HIV disease, we're here for number one. They came in for the Kaposi's sarcoma, which is related to AIDS. And this could be something, if you don't know, you need to look up. All right, so with that, whenever they have something related to HIV or AIDS and they're coming in for that, that B20 is listed as your principal diagnosis and then what they came in for. Okay, on an example of just the opposite, if they came in for, let's say, a broken tibia fibula, okay, you are going to diagnose that fracture first and then the AIDS HIV second, okay, because a fracture of the tibia fibula is not related to HIV disease. It's a little bit something to remember on the infectious side. The other different things here is review your sepsis for that, for infection. With this, it gives some great guidelines on all of these, so keep that in mind. All right, so let's go ahead and move on to chapter 3. Make sure you review these again. I do want to talk about diabetes and a few different things with diabetes that students seem to tend to, especially with the insulin. A couple of different things. Remember, when you go into type 1, which is type 1 or type 2, type 2, and then you have secondary. And secondary is going to be that it's due to a condition or induced by drug or chemical. So a couple of different things. If the medical record documentation is not clear on that type of diabetes, you need to go to E11, which is type 2. That's our default. So keep that in mind. When the type of diabetes, again, is not documented, but it does state that the patient uses insulin, again, you still need to go to type 2 because some people with type 2 actually do receive insulin. So the fact that a patient is receiving insulin does not indicate that they are actually type 1. So remember, type 1 is juvenile, all right? It's the body's failure to produce insulin. Where type 2 a lot of times comes in later in life, and that a lot of time is just you have insufficient quantity of the body's inability to utilize that insulin. Okay, so once we talk about the two different diabetes, the other big thing here I want to talk about is the long-term use of insulin, your Z79.4 code. you have that, okay? With that, remember, if I'm type 2, okay, keep in mind, type 2, you don't always use insulin, but sometimes you do. But let's say I do have type 2 and I'm using insulin, I am going to go ahead and add that Z79.4 long-term use of insulin. So if I'm treated with both the oral medication and insulin both, then I'm going to do the Z79.4 along with the oral Z79.84. A lot of, sometimes people are controlled with just taking a pill a day with that. So that's the big thing I really wanted to talk about with diabetes. Secondary, just kind of remember, make sure you're in the right section when you're looking up your diabetes code. Make sure you don't skip down to secondary. Make sure you're in type 1, type 2, or secondary when looking those up. The other thing is with diabetes, a lot of times it can complicate pregnancy. Just make sure gestational diabetes, know where you're at also, okay? With gestational diabetes, it's going to be an O code. Keep that in mind. Okay, let me look to see here what else we have. This is all covered if you need a little, and I did review everyone's review sheet, so you did a great job. But keep in mind, this is chapter 14 in your coding handbook for review. So let's go ahead and move on then to the next chapter. So with this chapter, chapter 10, we have the disease of skin and subcutaneous tissue. The biggest thing here, we're going to distinguish between your pressure ulcers. Make sure you know what stage. We have stage 4, stage 3 with the gangrene. And then the area, what area was the pressure ulcer at? So all of that needs to be distinguished. The other big thing with the skin, you have a lot of cellulitis possibly that you're coating. And as you can see here in this first one, we have cellulitis of the head and then left external ear. You can go ahead and code both of those. If you look here for the procedures, we're going to deal with debridement. When you do debridement of the skin, it's going to be that root excision. Okay. All right. So here we have, this is a little bit different. We have another pressure ulcer. We have stage 3. We also code it, if you can see here, congenital lumbar spina bifida. And with here, when we did do the fulguration of the skin, remember the fulguration is the root operation destruction. So as you can see here, we're kind of doing a lot of pressure ulcers. This one here looks like we had a flap graft, so that's going to be transfer. First you do excision. So the biggest thing is to make sure you are in your right, doing the right route for a lot of these ICD-10 PCS procedures. All right, so as you can see, cellulitis, they're going to be in your L or the L section. If anybody has any questions, I'm hoping this helps. Hope you have a good exam tomorrow. And once again, please reach out if you have any questions on any of these.